Welcome to Heartline, conversations with healthcare changemakers following their heartline. I'm your host, Dr. Andrea Austin. I'm an emergency medicine physician, coach, and educator. I believe that healthcare needs to improve the quality care that patients receive and that supporting the workers is at the heart of this transformation.
I'm Dr. Elise Putt.
I'm Dr. Andrea Austin.
I'm Dr. Amandeep Hansra.
I am thrilled to be at the Health Conference, and I have two fairly exciting, innovative doctors with me. I have Dr. Elise Putt and Dr. Amandeep Hansra. Could you both introduce yourself and tell us a little bit about what you do and the organization you represent?
Yeah. So this is Elise. I am a doctor from Australia. I'm here with Creative Careers in Medicine, which is something that Amandeep started. So I'll give you a brief rundown, but she'll give you probably a bit more detail. But we are a community for doctors, basically showcasing all of the different paths that you can take with medicine. So branching out into all sorts of different fields, such as tech, like we're seeing a lot of here at Health. But we have a podcast of our own. We have a conference in Australia and a big community there that's spread overseas as well. But Amandeep, you can tell a bit more of the context and the story.
Thanks, Elise. And thanks for having us here today, Andrea. So I am Amandeep. I'm also a doctor in Australia. I work as a family physician. I'm part-time now in clinical practice, but I've spent the last sort of 10, 15 years working really at the intersection of medicine and technology. So I spent a long time working for large corporates in innovation, working for startups and working for government as well. So currently I wear a few different hats. I work for the Australian Digital Health Agency as their chief clinical advisor. And then I also work with a lot of startups. So I've helped set up an angel syndicate investing in health tech. But really what I'm here today sort of representing and talking about is Creative Careers in Medicine, which is our large, almost 30,000 strong community of physicians, doctors, and across, as Elise said, mostly Australia, but we do have some international members. And we've really been helping them over the last 5 years carve out a pathway in medicine that they perhaps weren't exposed to when they went through medical school, getting them out of traditional roles and really helping them explore the things that are going to give them job satisfaction, help with burnout, let them have an outlet for their creativity and their passions, and really support them along their whole career journey.
That is so amazing. And what year did you start Creative Careers?
So I started actually in 2018, came up with the idea, and it was after I had left a chief medical officer role at a large corporate, and I didn't really know where to turn, and I was trying to find some advice, mentorship, people to support me, and there was nowhere. So what do you do when you can't find what you need is you create it and you build it. And that's really what I did back in 2018. Sort of 2019, we kind of went live online. But in 2018, we held our first conference and we sort of expected a few people to turn up. But we had about 400 turn up to the first one and we thought, okay, we're onto something. And now, as I mentioned, 30,000 people following us and still growing.
Wow, that is such an amazing story. And Elise, where did you enter?
So I joined Creative Careers in Medicine as a member of the Facebook group, which is where most of the online community is. I think in my intern year, which is probably around not long after it started. And I, through medical school, had thought, oh, maybe I don't want a career in clinical medicine. Always on the back burner, on the back of my mind, thinking maybe there's something else. So I would go intermittently and read through the posts on the page and sort of think, oh, maybe one day I'll do something like what these people are doing. And it wasn't until 18 months ago or so that I saw a post that I don't know if Amandeep had made it, but I ended up messaging Amandeep about a job that she'd posted in Creative Careers in Medicine, which wasn't actually with Creative Careers in Medicine, but that's how I ended up working with her there. So it's been 18 months or so that we've done a lot of stuff, honestly, in the last 18 months, but we've organized a conference. We've done, I don't even know how many episodes of the podcast, but probably
too many to count. Yes.
What would you say for the medical student or residents, or even you, really anyone out there, what are you seeing for trends as far as carving out a creative career?
I think generally, and this is across society, not just in medicine, I think the preferences of people coming through, graduating now is very different from previous historical ways that people ran their careers. People would get into a job, stay there for 20, 30 years, maybe move to a second one, but there was a lot of longevity in people's careers. I think nowadays people are kind of moving every couple of years, trying different things, much more exploring intersections. So much as staying in one sort of specific lane, they're mixing things like tech and medicine. They're mixing management and healthcare. And we're seeing that trend. Probably the US was ahead of us, but I think we're starting to see in Australia now that a lot of the people coming through are saying, well, I'm going to be around for a long time. I mean, think about life expectancy. That's changed the tenure of our careers, of how long we're going to be working. Who wants to stay in the same job for 60 years? So I think you're finding that people are much more interested in sort of diverse options or having multiple careers. Even in medicine, people are starting to go, well, I'll do one specialty and then I'm actually going to look at doing a different type of specialty afterwards. And things like technology and innovation lend themselves to that, because you can be cardiologist for part of your life and then decide to get into health tech and start your own company and be a founder. And so we're seeing that there's a lot more, push for that optionality, the choice, and the ability to change it up when people have had enough of one thing. So I think that's what the graduates are coming through with now.
I had a friend who's a pediatrician tell me a few weeks ago that all of her medical students are coming through saying they want to do health tech.
Really? Yes.
Through going through the hospital saying they want to do health tech, which is just great that people are exposed to that as an option, because I certainly wasn't exposed to anything outside of clinical medicine, bar maybe public health, as a medical student. But I guess through things like creative careers in medicine, people are seeing the other options that they have.
Yeah. And so I want to come back to your story, Elise. So do you do any clinical medicine right now?
Yeah, so I've done a bit of clinical in a lot of different areas. I still work predominantly clinically at the moment. Just before coming over here, I worked at a ski clinic over winter, which is a very, very fun and exciting job. And I've found I like the balance of both, a bit of clinical, a bit of non-clinical stuff, which keeps me enjoying both of those things and definitely keeps my skills and knowledge as well, which feels very relevant to anything that I've done outside of clinical work. But I am probably going to follow in Amandeep's footsteps and do general practice or family medicine training year after next.
Right. So for our listeners, the Australian system's a little bit different, right? It seems like there's a little bit more flexibility and time to really figure out what you want.
Yeah. So we do, instead of the first 2 years out that you do where you're already on a set training program, we do 2 years, which you rotate through all different specialties. And I think they're probably more similar to your final years of medical school. So you have responsibility of an intern, but you're not expected to be proficient in the specialty that you're rotating through beyond the lower level jobs of more admin sort of tasks. And then generally third year out, people choose. And they generally gear that first 2 years towards whatever they're going to choose. And I went into pediatrics initially, but there is definitely more flexibility to sort of go between different things, do a year here, a year there of different specialties for the skills. And especially people that go into general practice often do years of critical care or years of acute medicine or whatever it is to gain those skills and knowledge before going in. What I've done is definitely not the norm though as well. So most of my friends from medical school are well into their training of whatever they've chosen to do. So I'm still off the classical path.
Well, you seem to be thriving being off that classical path. And I'm curious, Amandeep, if you had some medical school deans around the table right now, what would you be encouraging them to think about?
Yeah, actually, I have had an opportunity to have some medical deans around the table. I think when we were trying to build digital health capability in our workforce. So, I mean, it's great that Elise is seeing junior doctors coming through really interested in health tech. But one of the things that we were trying to do was make sure it was included in the curriculum so people came out with some level of digital literacy and capability in the hospital system. It's very different using your iPhone versus using an EMR and learning why you're capturing data and what you can do with that data, what sort of insights you can get. And now with the explosion of AI, understanding how do you assess AI, how do you know what technology is safe to use, how do you assess privacy and security. There's so many considerations, and it makes me a little bit nervous for people coming through now how much they have to know outside of just all of the ologies that we learnt in medical school. There's now this whole technology stream. But I think I would also like the medical deans to understand that there are lots of non-traditional career options, and I would like the non-traditional to become also traditional, that there is, exposure given to people in their early years of what a career in medicine can look like. And it doesn't have to be you choose between being a surgeon, a physician, or, going into family medicine, which are sort of like the three buckets that we're exposed to. That there are, all sorts of options, whether it's in management, leadership positions, whether it's in consultancy, whether it's in health tech or innovation. And we're seeing a lot of those roles now be created by healthcare organizations where they're actually wanting to employ and engage clinicians in those roles, yet we're not curating them from an early stage in people's careers to give them the necessary skills. So we do find often when people want to change out of a traditional role into whether it's management or into a health tech or an entrepreneurship role, that then missing or lacking some of those skills around, say, financial management or governance management or leadership. And if we can give people those and build those into the curriculums during medical school, I think we're going to end up with a workforce that's quite adaptable and flexible, and also will give them the sustainability, the interest, the longevity to do whatever they want during their whole career.
I love that call to action and message. And I'm thinking a lot, I teach in a certificate program for simulation that's offered by the military. And I think physicians are often drawn to more degrees, just kind of the way we are. But you look at we're here at this conference, Google has a booth, and Google offers all these various certificates that you can get on AI or cyber security. And I'm curious what your thoughts are, either Elise or Amandeep, on having certificates or other ways that aren't formal degrees that physicians can dabble and learn a little bit more without investing so much more time.
Yeah, this is something that we explore on our podcast quite a lot, because there's definitely that drive that if someone in medicine wants to do something else, they think, okay, the first step is to go and study. And to be honest, a lot of people like learning as well. Mm-hmm. So a lot of them quite enjoy the studying aspect rather than feeling like they need to do it in order to get to where they want to go. But that's definitely rote learned. And it's also something that I've found come up again and again and again, because I speak to a lot of people that have just gone and done something rather than studying to do something. They've gone and they've done maybe an entry-level job in another field, which is hard to do, going from if you're a bit more senior in the clinical space. But they've gone and thrown themselves into tech or business or whatever it is. And everyone says that they've learned more doing that than they ever could have by getting a degree. But it is hard to unlearn that pattern that that's the only way to get a new job or a new experience.
You can.
Yeah, I think there's a huge emphasis in medicine around qualifications and post-nominals. We always kind of laugh at how many letters we all have to put after our names to feel validated in doing something. But I think in other industries, there's a lot more emphasis put on experience and actually just going and doing the job and learning on the job. Whereas I think in medicine, we're always taught you can't learn on the job because you might kill somebody. So you need to have all of these qualifications. I remember even in Australia, it was getting a certificate for putting an IV cannula in, which
hand hygiene.
Yeah, hand hygiene certificate. Everything had to be certified. Whereas I've worked in the corporate sector, and it's this person knows nothing about this area, but we're just going to chuck them in the deep end and see how they go. And I guess that's because you're less likely to kill somebody. But I do think that we need to move away a little bit from those formal qualification sort of emphasis. And I see this with a lot of clinicians wanting to get into whether it's management consulting or in management roles or into entrepreneurship, where they all feel like they need to go and do an MBA. I'm well, what do you want to learn in the MBA? And they'll be financial literacy. It's we go do a micro course on that. Well, you want to learn about AI. There's, micro credentials you can do in AI, or a course I think you're right. Like a lot of the technology companies are putting out great courses. I think that we do need to teach people how to do continuous learning in this new environment, which doesn't require 3-year-long degrees and doesn't necessarily come from a university, that it can come from other parts of the sector. Because I think one of the most important things to learn for a career of the future today is how to keep learning, because our jobs are going to keep changing.
Yeah. And I'm curious, so Amandeep, do you still do some clinical medicine?
Yeah, so work in a general practice in a family physician clinic. Okay.
Yeah, I feel like we're maybe in the same phase of our careers. I graduated medical school in 2011.
Yeah.
And so one of the things I'm thinking about right now is, I would say probably 50 to 75% of my time, depending on the month, is non-clinical. So 1 to 2 days a week is clinical at this point. And, I have noticed that, the deep learning of walking into a room and knowing somebody's sick, not sick, and like the interconnectedness of being able to understand something of the mid-career physician is very, very deep. But sometimes retrieving medication dose or, a specific algorithm, and I have to look it up again. And I've been like, maybe I should be working more clinically. And I've really had to coach myself that it is absolutely okay for me to refresh on this.
Yes.
And with AI coming out, I'm actually really excited. Why do I have to remember? I mean, for the residents listening, the medical students, I do think there was value in memorizing a lot of different things and having that deep learning. But at this point, if I just need to refresh, I think that's okay. But I'm curious how you're navigating that.
Yeah, look, every day I have the same dilemma. I go into clinical practice and I think, am I doing my patients a disservice because I'm not here 7 days a week and seeing as many patients as the doctor in the room next to me? And I have to keep reminding myself the same thing, to say I'm actually probably safer because I'm not relying on recall. I am always constantly a little bit anxious that I don't know everything, which means I look it up much more often than I would if I felt overconfident. And I agree. And I think that my role in helping build technology and advising on that side means that maybe I can help build some of the systems that are going to help future clinicians not have to rely on their memory and recall and actually focus on providing really good care with the patient in front of them and then sitting there trying to remember what they were taught, a few years ago and relying on that memory. Because one of the other things that I found, and I don't know how it works here, but in Australia, when you end up working in family medicine, you're kind of working on your own in your own clinic, in your own room. You might see your colleagues sometimes in the tea room, but you very rarely compare notes. There's not really team-based care. So half the time, I don't know if what I'm doing is best practice. I don't know what my peers are doing. And I keep thinking, imagine if technology could solve that for us, where we could start to see if our practice was aligned with what everyone else was doing, if we're actually up to date with the most recent evidence, if our patients are actually having really great outcomes. And all of that's going to come from helping to build the technology to support better care. So I feel like I'm still contributing in many ways, probably to support people like myself, like yourself in the future, that can practice part-time clinically and still feel like they've got all the tools and systems in place to keep them just as safe as someone who's doing many, many hours.
Yeah. Elise, any reflections, any threads you want to pick up on?
Yeah, I feel like the whole discussion about AI and tech in healthcare is super interesting because in one part, I'm in this discussion with people like Amandeep and I hear all of the benefits of it. And then I'm still working in public hospitals in Australia, which are a long way behind in terms of technology, which has been a long-standing problem. But you speak to people and most people are scared of either things that will take their jobs or scared of the consequences of data leaks or whatever it may be, just something they don't understand very well. My view on it is that AI is going to do all the things that I don't want to do. And so I am very happy for AI to write my notes. And I would love something like what Amandeep was talking about, where it's giving me feedback on my practice as well if you're operating in a silo.
Yeah, I find the thing about AI taking our jobs as physicians so surprising that some of our colleagues are perseverating on it. When you look at that, obviously I'm a little bit US centric, but even if you pull out to global, the demand for healthcare is incredible. And we certainly are not meeting the quality metrics in the US. Just looking at maternal mortality is abysmal. Infant mortality, it's ridiculous. So if we could have AI free up us to really be focusing on what we should be, I think it's at this point, I think tech is the great hope for bringing quality back and also taking care of healthcare professionals.
Yeah, we've been to some great sessions where they've even been using technology to measure medical workforce well-being, getting rid of the usual surveys and all the traditional ways we've been measuring how well our clinical workforce is going. And so some of those things that we've seen, we're like, there's just so many opportunities if we get it right. And we've got a lot of naysayers back in Australia, but obviously I think that would happen globally where people are resistant to change. But to your point, I think we're on a burning platform where the demand is outstripping the supply. And if we don't use technology, we just have unsustainable health systems. So it's not like we have an option. I think it's not an option to use technology. It's just, how do we do it? How do we do it that's safe? And how do we do it that's clinically led and, with the right people around the table making the decisions, which is why we're talking about how great this conference is, because if we can bring clinical people in here to work with all the other parts of the ecosystem to build the right technology for the future to make sure that we can continue to, serve our populations.
Absolutely. And I would highly encourage listeners to come to this conference. I sat next to somebody that was the chief strategy officer for a company that's looking to create essentially like a viral panel from home. And he was so receptive to my perspective as an emergency physician and listening to the pebbles in my shoe, my pain points, and like really taking it in. And I think sometimes as doctors with the burning platform that we're on, we're kind of like everyone's out to get us and nobody gets it. The admin, the tech, the business, they're all money grubbing. And that has not been my experience here. Everyone's been very warm and very respectful of my perspective. So what's your thoughts?
I think, and Amandeep will speak to this, but there's so much importance in getting doctors involved in tech companies. From my brief experiences with tech in Australia, there's a huge disparity between the companies that have, because there's a lot of companies working on clinical problems that don't engage with doctors early on. And that makes the world of difference to how useful and how well receptive their product is as well. If you get doctors involved and they're involved in building it, then they're going to speak to their friends about it. It's word of mouth, and as well as creating the product that they actually want to use. But my experience here for sure has been positive. It hasn't felt like there's a lot of doctors involved in all of the tech companies that we've seen presented here, but everyone's felt very receptive to talking to anyone and everyone about their take on their products as well.
Yeah, I feel like healthcare is a hard space to innovate. If you choose to come and work here, it's because you have a passion. Like if you're an AI engineer, you could work in a number of different industries. If you choose healthcare, it's because you want to go to bed at night feeling like you're doing something positive for the universe. And I feel like those people that are here, while they may not be clinicians, are very respectful of the things that we do and very understanding of the challenges and pain points and how difficult it can be to go through change management when you've had certain workflows for many, many years. You've had clinicians who are used to doing things a certain way. It's not because none of us want to change. It's just the risks can sometimes, feel overwhelming. But I think everybody is driven by the same mission. We all want the same thing, whether we're medically trained or not. We all want a health system that supports our population and delivers great quality care. I think it's just sometimes we can operate in silos and it can be hard to break down. So, particularly in Australia, we talk to a lot of the technical folk and they're like, so hard to get in front of a clinician. Like, tell us how to do it and we will do it, but we don't know how to do we just call their practices and say, let us speak to them? So part of what we've been doing, definitely at Creative Careers in Medicine, is trying to break down some of those barriers and make sure that, we've got clinicians who know how to add value to technology companies or to products, and then also having companies that know where to go. They can come to us, and we've got a whole network of clinicians that are willing to give their time and energy into building some of the systems of the future. And one of the other things that we have now is this angel syndicate where we invest into health tech. So we actually get physicians to invest in the products of the future that they're going to use. And that, again, builds that ecosystem of funders, of users, of the technical folk building things and trying to create, more of a robust ecosystem that's going to deliver value.
I love it. And we are looking at a unicorn running around behind us, literally in an inflatable suit. This is a very fun conference. Well, I want to turn it back to creative careers. And for the listeners out there that aren't familiar with your platform, what's your pitch? Why should they join Creative Careers? What do they get from it?
Elise, you've been a member, so you know what members get.
So from joining the Facebook group, so the Facebook group is open for doctors and medical students. From joining the Facebook group, you get to join a community, and there's a lot of discussion in there around a whole range of things. So there's things from job opportunities or people sort of broadcasting their side hustle or their product, self-promotion threads. We've got people doing things like acting, writing books, or people in tech. And then a lot of it as well is people who post and they'll say, hey, this is where I'm at in my career. Like, these are my skills and this is where I think I want to go. And we get a huge response to things like that. They get hundreds of comments, or at least tens, sometimes hundreds of comments saying, oh, I've been in this situation before, I can relate. People connect through there. And then broader through our podcast, we have webinars, and through the conference, people can get access to all of these amazing people that have done incredible things in different directions in medicine as well. So I find what I drew from it before becoming involved the way I have now was inspiration, which is still what I get. I feel like I have too many career options now rather than not enough, which is probably how I felt before joining the group. Felt very much like, this is the one thing that I can do with my career. I can either go into public health or go into clinical medicine. And now I've got too many options to choose from.
Yeah, I mean, that's so great to hear, because obviously, I'll be biased because I've built the community. But I think for me, it is really that, not feeling alone in what you're experiencing, people really at crossroads. And we have kind of the push-pull thing. We have people who are pushed out of the health system because, not great workplace cultures, bullying, whatever, feeling burnt out. And then we get people who are just interested in exploring other things. So we've got quite a mix and diverse sort of community that, as Elise said, we're really trying to provide that support, resources, and helping people upskill. I remember we had a whole session just teaching people how to use LinkedIn because doctors did not know how to use LinkedIn, teaching them about networking, teaching them about marketing, teaching them how to build their, a business if that's what they're interested in. So we've really just been there kind of helping people along their journey in kind of an unofficial capacity, but now we're sort of getting recognition from some of the official colleges and official peak bodies in the country who are coming to us saying, we need you to help our members as well, because everybody's exploring. And so that's really been, the crux of this kind of whole community is to help people explore and give them a community to support them to do that.
Yeah, I think that's an important thing as well, that you don't have to leave medicine. You don't have to leave clinical medicine. You can find other things that then make staying in clinical medicine more sustainable for you and bring you more joy and satisfaction from your overall career.
I love it. As we wrap up, how can our listeners connect with each of you and Creative Careers?
So Creative Careers in Medicine, if you search that on Facebook, you'll find the Facebook group. The Instagram is Creative Careers in Med. And then for each of us, you can find us and Creative Careers in Medicine on LinkedIn.
And follow the podcast.
Oh, yeah. The podcast is on all of the usual platforms, so Spotify and Apple Podcasts, and it's called Creative Careers in Medicine.
And I'm so thrilled that I will be on your podcast later today. So we'll definitely need to cross-link in our show notes.
Perfect.
Amazing.
Thank you so much for having us.
Thank you. Thanks for listening to Heartline, conversations with healthcare changemakers following their heartlines. I'd so appreciate it if you could take a quick moment and hit the like button and also the subscribe button that you'll find within your podcast app or platform that you're listening on. It also really helps if you can leave a review. I would certainly appreciate a 5-star review and a few comments about what you liked about this podcast. Don't forget, you can also forward this to people in your network. People love getting new podcasts and changing up what they're listening to. So sending a podcast to a friend or colleague, or even to start a conversation about a change that needs to happen in your organization, is a great way to be a change maker. This podcast represents the views of the host and guests. It does not represent the views of any entity we work for or with. It is also for informational use only and does not replace any professional advice, including medical or psychological. If you are interested in unlocking your true potential, reach out to me. If you're an organization interested in supporting the well-being of your people, I'd love to connect on innovative solutions. Schedule a strategy session at AndreaAustinMD.com. Sound editing services are provided by Better Podcasting Services, and you can find their website at betterpodcastingservices.com. And I'd also like to thank our future Dr. Caitlin Din, who is the production assistant for this podcast.